Newsfirst Newsline with Faraz Shaukatali.
And a very good evening to you and a warm welcome to Newsline Zoom. Zoom, of course, because of the ongoing COVID-19 pandemic, and we here at Newsfirst are also doing our bit to try and make sure that the disease isn't spreading as much as it is right now. Now then, our guest this evening is not only a doctor, but he's also the General Secretary of the Communist Party of Sri Lanka, Dr. G. Weerasinghe. Very good evening to you, Doctor.
Good evening. Good evening.
Dr. Weerasinghe, my first question to you is that various 9 parties plus yours supporting the SLPP called on the government to impose this lockdown. But a colleague of yours in Parliament, Mr. Gamini Lokuge, says that this is an international conspiracy. So what's the real story? Is it an international conspiracy?
Yeah, okay. You see, now it's true that, a few days back, around 10 political parties that are attached to, or that are the constituent parties of the ruling coalition made a joint request for a lockdown, right? Actually, they requested for a lockdown of 3 weeks. Now, before going to this conspiracy allegation, let me, explain you the context in which, or rather, which compel these political parties to make that request. By now there are, you see that, we have surpassed 400,000 cases of COVID cases, and more than 7,900 deaths due to COVID, right? And if you take yesterday, actually there had been over 4,500 cases and closer to 200 COVID deaths. Now we see that the PCR positivity rate, when you do the PCR test, the positivity rate has gone up, and majority of those are this so-called Delta variant, a mutation of the original COVID virus, right? Now, what is the actually, on the other hand, we see the bed occupancy rate. There are around closer to 80,000 beds in the country totally, and we know that there is a circular by the Director General of Health Services where they have instructed to use 50% of them, right, for COVID. That is around 40,000. And what I can tell you is that around 90%, closer to 90% of those beds are filled at this moment. And ICU beds, probably more than 95% of them are filled, right? This is, you see, actually this happened with this new Delta variant. Delta variant actually has a shorter incubation period. That is that when you acquire the infection, time gap to show the symptoms, it's shorter, and it's severe illness, and the oxygen requirement is more. So you see that this is the situation. And on the other hand, we see the health staff is getting infected. Now, at the moment, probably more than 300 health staff of National Hospital is infected. Over 100 health staff is infected from all these teaching hospitals around, right? So that is the situation that you see that we, the context. On the other hand, what about the vaccination situation? Vaccination situation is around 1.2 million people have been given at least 1 dose. But the 2 doses, which is required to have the immunity, right, is being given closer to 6 million, probably around 4 or 4.5 million must have been given at least 10 days before, 10 days back. Must have completed 10 days back. So what we can tell you is there are around 4 million or 4.5 million of people who have built up immunity in their bodies. By vaccination at the moment. So that is closer to 20% of the population. So we are actually, in this situation, what we see is that, that we are heading to a situation where we are going to have 6,000 to 7,000 cases a day very soon. And then we will surpass 200 deaths a day. What is the meaning of this? The meaning is that next 4 to 5 months, we are going to have over 30,000 deaths. Over 30,000 deaths. So in this situation, for us, we had to think what steps we can take to prevent this situation. What can we do? The most effective step would be, to go for a lockdown. Now, why? Now, what is the rationale? What are you going to achieve by having a lockdown? The major, or rather the main objective of that kind of measure is going to be to break the transmission chain. Suppose I have acquired the infection yesterday. Now you have imposed the lockdown from today. I am confined to my home, right? My house, right? So you see, I may infect my people in my household, but since I can't go out, I won't be able to infect rest in the community, society. So that is what we want to achieve. At least if we can achieve 80 to 85% of restriction of movements, right? So we should be able to achieve a very good level of reduction of transmission. And what is the meaning of that? You are achieving the reduction of transmission rate. That means you will have less cases. So that means less hospitalization. That means less deaths. And that means finally a relief to, the health, overburdened health system will have a kind of a relief, right? Which is a dire necessity for the health system at the moment. But you see, achieving that is not enough. And what we have suggested there is to use that opportunity to expedite the vaccination program. Okay, the vaccination program. So this is what we said. Is this a conspiracy? Can you name this as a conspiracy? Why do you want to call it a conspiracy? You see, now for us, coming back to this conspiracy question.
Yeah.
Right? Now the cabinet of ministers under the president actually is the executive arm of the government, and which is not represented by all these political parties to the government coalition, right? But more importantly, this the coalition is not meeting at the leadership level. So you see that now cabinet is not a substitute for that kind of interaction. You see that now when you have a coalition of many political parties, that you need to meet and discuss, especially in a grave situation like this. So, if it is not.
Dr. Weerasinghe, are you saying that the leaders of this coalition, of this consortium, if you like, this coalition, are not meeting on a regular basis?
Yeah, of course. You see that as the leadership level, actually we have not met. There had been 1 or 2 meetings in the past, but they also were. I can't call them leadership meetings because there were many participants in those meetings, but not in recent past even that kind of meetings. See that.
So do you think in the end, at the end of the day, we shouldn't really be paying much notice to what Mr. Gamini Lokuge is claiming, because it is it makes no sense, and whilst the real issue is to try and see what we can all do to control the spread of this remarkable disease.
Yeah, of course. You see that now for us, that now in a situation like this, political parties are expected to express their views, because that is being that is being required by their party memberships. Because in the end of the day, we are responsible. We have a responsibility towards the people of the country, right? So then, of course, like-minded people get together, and when they have similar views, right? I mean, this happens. Now, that is what happened in this situation. You see, situation is so dire, you simply can't be silent, right? You need to analyze. I can tell you, you see, now the WHO, right, the independent experts, all of them came out with, right, I mean, they analyzed the situation, and they showed the country, right, that you need a lockdown. So you see that, and once we hear all these voices, and we ourselves being, health, people who are familiar with health situation, how can we keep silent, right? So, I mean, what we have actually done is to request the government to go for a lockdown, and, using that time, you see, to expedite the vaccination program. Actually, we requested the Director General of Health Services to use all the potentials of the health system. Now, all the potentials, what do I mean by that? The meaning is that, you see, now to use hospitals and all the other clinic, whatever the centers that they are in, they have in the system to provide vaccines. Really speaking, for us, we are not very clear about vaccination program at the moment. You see that how many vaccines do we have in the country? I mean, how many doses? How many you see that they say, okay, the numbers, they say that, we have given about 12 million doses at least as the first dose, and then, closer to 6 million as the second dose, but that's good. But then how many people still are waiting? Over 60. Over 60. And people with other comorbidities, other diseases such as, diabetes, kidney disease, high blood pressure, and, chronic lung diseases. This type of people, you see, there are many. How many of them have been given? All this data should be available, and Director General of Health Services should come out with a clear plan. They have to tell us, okay, this is the way that we are going to do. Now, you see, we saw His Excellency President said that we are going to, complete the immunization by end of September. That is good. That is okay. The stated target is that. But how are you going to achieve that? There should be a plan. So this plan, I mean, people have a right to know the plan. The Director General of Health.
And the plan in this implementation process, where does our military forces, where do they fit in?
Yeah, you see that now for us, we can see the military is doing this in a very big way. But, where's the health system? What health ministry? Now I mean, it's very good that we have the support of armed forces. But then you see, where is why don't they use hospitals, for an example, to provide vaccines all over the country? You have closer to 700.
But I have this question to put to you, Dr. Weerasinghe. We're told that there are approximately 90,000 beds around. That's our maximum capacity in terms of beds, private and state institutions, 90,000. If you take 50,000, it's around 45,000 beds allocated to COVID. But we needed 90,000 at the beginning anyway because of the other illnesses that people will be hospitalized for. In between all this, no one seems to be talking about the children. What about the children? Do they need vaccine? What kind of danger are Sri Lanka's children in at the moment?
You see that what we see is that increasing number of children are getting infected, and unfortunately we have started. I mean, we hear that children are dying out of this infection also. And you see, to be fair, that we know that health system is geared to look after children also. But so that now at the moment you see that we don't give vaccines to children below 18 years at the moment, right? I mean, I mean, there's no point in talking about children below 18 years because we have not completed even above 60 yet, right? Above 60. So you have to complete first above 60, and then of course you have to choose your priority groups. But now in a country like China, say for an example, they are planning to give vaccines to children above 3 years. Of course, you see that we can't compare ourselves with countries like China. But nevertheless, what I'm saying is that, now we have to come down on these priority list, and we have to think of giving vaccines to children also. Our government also, I mean, the health, authorities are, I know, they are discussing about at the moment, there are discussions about the possibilities of starting the vaccines to children also, but from which age, I'm not too sure yet. But then you see that.
Let me just stop you there, Dr. Weerasinghe. It's now time for a quick break and a peek at this evening's headlines from the Newsfirst Primetime News. We'll see you on the other side of the break.
Newsfirst Newsline with Faraz Shaukatali.
And welcome back to Newsline Zoom. I'm in conversation with Dr. G. Weerasinghe, who is, of course, the General Secretary of the Communist Party of Sri Lanka. He's also a public health specialist. Now then, Dr. Weerasinghe, today is International Doggy Day. Very quick question from you. Can this disease, the COVID-19, can it be transmitted to our pets?
You see, that is what that we hear from different parts of the world, that this can be transmitted to the domestic whatever the animals, pets, and other animals. Yes, it can.
And I thought I better get that out of the way. But on an equally serious note, are you of the opinion that this lockdown, which ends on the 30th, should it be extended?
You see, really speaking, we requested a lockdown for 3 weeks. Why? That is with reasons. Actually, when a person acquires the infection, okay, the day that you go for the lockdown, if there are people who have acquired infection that day or day before that, they will develop the disease probably in 3 to 5 days, right? And another 10 days probably they will have the disease, and then there is a possibility for them to pass the infection to rest of the community, right? So you see that it is roughly about 2 weeks, right? And what is going to happen is that if you have a 2 weeks lockdown, immediately after that, the acute period, you are going back to work, right? So that is what happened. So therefore, it is really good if you can have another 1 week. This is why we asked for 3 weeks lockdown. But unfortunately, here we have been given 10 days lockdown, and you see that the way that we thought was that it's good to have 3 weeks. What is given here is 10 days lockdown. But nevertheless, right? This is going to be a useful break, right? And we will see the results probably next, after 10 days or 2 weeks. We can expect.
But when we lock it down for 10 days or 2 weeks or 3 weeks or for whenever, Dr. Weerasinghe, as the Secretary General of the Communist Party, I'm sure you're aware, over 60% of our workforce are daily waged. So what do these poor folk do? I mean, surely 2,000 rupees isn't going to get them far.
That we don't say that we are not sensitive to that part for us, right? We know that about 60% of people are in informal economy in the country, right? About 14% in the government service, about 26% in organized private sector, but remaining 60%, most of them are daily earners. We know that is, they find it, they face enormous.
So how do we address that? How do we address that?
Actually, now this is, we are calling the government only to go for a lockdown only for 2-3 weeks, and for those 2 or 3 weeks, actually, it is the responsibility of the government to provide some kind of relief to the most, I mean, all these 60% may not require the relief packages or whatever the assistance, right? But so you can identify the most needy people and to provide them some kind of relief, right? I mean, maybe a package of food or whatever, right?
But, uh, but doctor, if we were to do that, like this Samurdhi payments, it will end up being ever so politicized. And in a day and age where bank accounts and online banking and facilities are available, why is there no move to ensure that everybody has these bank accounts open, and so that the government can do what they do in India? They just transfer the money straight into your account. No politics involved, no politicians even in sight.
I fully agree. I fully agree with you, Faraz. You see that your concern is my concern as well. You don't actually, in our proposals, we have proposed the government to go for a community-based program, right? And then, of course, there we have suggested further, right, to have a all-party mechanism to tackle this, and to have an expert committee to help all-party mechanism, right? If we have all these things, I mean, you can stop politicization of some of these activities. And when it comes to relief packages, if you have these community organizations at village levels, you see, you can implement this, providing this relief through that kind of the community organizations at village level. And sometimes even without receiving this so-called government relief, even the villagers themselves will look after the people who are very poor in their communities. You see, this is this is why we have suggested the government to right from the beginning, our party has suggested the government to go for a community-based program, right? Involve communities to tackle COVID. Even now, it is not late for us to introduce, I mean, to go for a or to involve communities in this, because for many more months probably we are going to live with COVID, right?
And so the Communist Party of Sri Lanka would back a move to increase or to extend the current lockdown or the curfew situation for another 2 or 3 weeks, is it?
Yeah, you see, our request actually, we stand by our request. We requested the government to go for 3 weeks, but they have given 10 days thing, right? But we are, nevertheless, we are of the view. I mean, we think that even this 10 days is going to be useful in bringing down the caseload. I mean, we are very much sure of that. But
as the Communist Party, what do you say to paying people less, like going for a salary cut in the government sector? What do you say about that?
Yeah, for us, you see that now, really speaking, that kind of request should be preceded by the examples of the top people, right? My view is that, you see, actually, starting from the president, the prime minister, the cabinet of ministers, and then the parliament, if they, you see, come out with an example, all right, with the I mean, if they are ready to sacrifice, whatever the percentage, and then of course they can make a request from the salary earners also. I don't know, maybe to donate 1 day's salary, 2 days' salary. Now, if you think this way for us, right? If you now there is no government servant who is getting less than 30,000 rupees a month.
Yeah.
So if they donate 1 day's salary, that is 1,000 rupees. 1,000 into 1.5 million, army of government servants. So that will be, you see, probably 1,500 million rupees.
But what about setting an example, leading by example, and all that business? Why can't we have the president, the prime minister, the cabinet of ministers, and the entire parliament? Why can't they all come out and say, look, for 1 year we are not going to take our salaries or our perks, I mean our financial perks, we will just keep the vehicles and fund it all ourselves? How about them doing that?
Yeah, you see that I don't want to get involved with these figures, but what I'm saying is, as a principle, or in principle, right, they have to set the example from the top, and then request the people in the government sector, I mean government service also. I'm sure even in the people in the private sector will come out. Yeah, there will be a lot of other people who will come out, but then you have to start it from the top.
But all this will only work if we have leaders and we have legislators who are exemplary models. So to start with, we need to have that. Do you think that we have exemplary models enough in Parliament and in our provincial councils?
You see that, I mean, you see that now we don't have to, we don't have to discuss the behaviors of the past examples or whatever. But even at this, at this very, serious situation that we are in, even at this moment, if they can set an example, right? So that will be helpful, right? I'm sure that will be helpful. So there is no other way, actually. You see that we are talking about economic difficulties, but same time, I know that you see that economically important areas are not closed also, right? The factories, this kind of things are.
Yes. Doctor, just ahead, just as we're coming to an end of this program, can you say, would you choose between a lockdown or would you choose the economy? And what do you say about projects like building roads, installing portable gymnasiums around the country, and other, the Sandalwood Park, somebody was telling me about that yesterday, 400 million rupees apparently. Which would you choose, the lockdown or all these other projects, including the gyms and the Sandalwood Park?
You see, we are very clear on this matter for us, right? If we are, if we continue this way, we are going to lose 30,000, at least 30,000 lives next 5 months, right? As the Communist Party, we are not ready to accept that. You see, let us save those lives as much as possible, right? And economy is, I'm not convinced that we are going to be collapsed to the ground because that we are going to close the country for 2 or 3 weeks. And you see, there are many projects, as you said, multi-million projects that are going on, which we can stop for a while. We can survive without them. But let us save, the lives. And if there is a person who thinks that we can sacrifice those lives, 30,000 lives, in the name of economy, Communist Party is not agreed or agreeable with that kind of position.
What about very quickly, very few seconds left, what about the menus of this world? What they say, I'm told that these various menus are saying that these are sacrifices, these deaths are sacrifices. What do you say about that then?
Yeah, I don't know. There may be certain people, who wants to, go by those kind of soothsayers or whatever. But Communist Party is not ready to accept that kind of thing. Actually,
so would the Communist Party say, instead of all that, Sri Lankan lives matter?
Of course, yeah, of course.
On that note, Dr. Weerasinghe, thank you very much for being on Newsline Live. It's been a pleasure having you, and of course, as always, take care and God bless you.
Newsfirst Newsline with Faraz Shaukat Ali.